others. So for today's, our goal is to complete all these 4 disease conditions. Okay, understood? Okay, so let's talk about the first thing that we're going to talk about is our asthma. Does anyone of you, so we are going to talk about asthma, okay? So anyone of you ever met a person who had asthma? Anyone of you, anyone having asthma right now currently? No? Any? Okay, so let me talk about asthma. So if you define asthma, it is a situation where it is an inflammatory condition of your lungs. Okay, so what is happening? It is an immune mediated. Second thing, it is a immune mediated. So what happens actually in asthma? Can anyone tell me if you have any knowledge, previous knowledge about these kind of lung diseases?
It is reversible, ma'am.
Due the cause of this, it's a bronchospasm, ma'am. Due to bronchospasm,
Yeah.
there will be
It is a smooth muscle hyperreaction.
inflammation of airway.
Yes, it is an inflammation of your smooth muscle. Okay, so it is an inflammatory condition of your lungs. It is an immune mediated in which the smooth muscle of your respiratory get hyper reacted. Okay, tell me one thing. So just understand one thing. As I have told you about anatomy and physiology yesterday. So this is your trachea. Okay, so trachea is lined by smooth muscles. Yes. Okay. So there are specialized columnar epithelial lining over here. And there is cilia present.
Yes, ma'am.
So what happened? For example, you are just passing by an cotton mill. Just imagine you're passing by a you're just passing by a cotton mill, or there are so many pollen grains around you, or you so in the month of October and November, when there is uh, winds are blowing very fast and there is so much pollen all around your environment. So understand one thing. So whenever there is pollen grain will be present in your airway, what will happen? What normally should happen? These cilia should move this pollen grain out of your lungs. But if a patient is having asthma, what will happen? These cilia or these cell, what will happen? These pollen grain will act as antigen into our body. Okay, antigen. So these pollen grain will act as antigen in our body, and due to this antigen, there will be an immune reaction will happen. Whenever you have immune reaction, your body will get the blood vessels which are lining your trachea. What will they happen? What will happen to them? They will get over dilated. They will get over dilated, and there will be an increased influx of inflammatory mediator, which is known as mast cell. There will be an increase in the value of IgE, or there will be increase in tissue necrosing factor. There will be an increase in we have monoclonal antibodies, or there will be an increase of interleukins. So what are these? Your mast cell, your IgE, TNF alpha, your monoclonal antibody, or interleukins. What are these? These are the inflammatory mediators. So whenever antigen is present in our body try to protect ourselves. So in order to protect ourselves, there is a massive vasodilation. So there is a VGFR also, growth factors also. So there is a massive influx of immune mediator, which are this mast cell, IgE, tissue necrosing factor, monoclonal antibodies, interleukin, your vesicular growth factors. So these will increase in number. And when these will increase in number, there will be an overdilation of blood vessels around this, and they will increase in secretions. So they will increase their secretion. So they will increase their secretion, and there will be a vasoconstriction with increase in secretion. Did you understood, or should I repeat this again? Let me repeat this again in a very easy form now so you can understand. Understand what is happening actually. So just understand there is an antigen. Antigen is your pollen grain. Okay. Understand one thing. So pollen grain is entering in your airway. So our body consider this pollen grain as an foreign body, and it start producing so many inflammatory mediators. So these inflammatories are mast cells, okay, your phagocytosis, your eosinophils, your basophils, your neutrophils, your TNF alpha, TNF, okay, interleukins are produced. There are different type of interleukins. There is growth factor. So what these immune mediators do to your airway? So they increase this secretion into your airway, and hence there will be an vasoconstriction, okay, and there will be increase in the secretions. Did you understood, everyone, or should I repeat again? Rupa, Patu,
Good, ma'am.
Govindraj,
Understand, ma'am.
understood,
Yes, ma'am.
Yes, ma'am.
everyone? So this is the pathophysiology of how actually there is you're having asthma, okay? Okay, so one thing I want to make cell. So there is a big mast cell. So whenever you know what mast cells are, these are an immunoactive substance which is produced in your body. So these mast cells contain granules. So these mast cells are the granulocyte, and they have something called histamine into them. Histamine, okay? So mast cells, they have granules which is called histamines. And do you know what histamines are? Have you ever heard of S2 receptor blocker, histamine, antihistamines? Yes or no?
Yes, ma'am.
So, okay, and I want to teach you drugs also. So it's better you understand the pathophysiology also at the same time. So if I will teach you drugs, so you can correlate both of them, and it will become very easy for you to understand drug. Because if you understand the disease progression, it will be easy for you to understand why this drug is acting and how this drug is acting. So it is very important for you to understand the pathophysiology first. Okay, so what happened? There are histamine receptor present in your airway. Okay, let me make this thing very more clear to you. So, and if this is your airway, so if this is your airway, have small receptor, which is called histamine. There are different of histamine in our body. There are different type of histamine receptor in our body. Depending upon their location, it differ in their action. So, if the histamine are present in your airway, what will they do? They will vasodilate these blood vessels, and there will massive secretion of transudate into your airway, and they will increase in the secretion. There is a vasoconstriction, and these histamine also produce running nose. So this is the role of your histamine. Okay, so do you know understood where the histamine are coming from? They're basically coming from your mast cell. Okay, so if I will teach you why are we giving antihistamine in respiratory or asthma, you will get clear.